service of Barber National Institute.
Time to welcome in now Cecilia Hollins, Director of Clinical Programming at Barber Behavioral Health. Welcome, Cecilia. It's nice to have you back.
Nice to be back.
And it's Depression Awareness Month.
It is Depression Awareness Month. And I think it's important to recognize these types of observances because they really do help to reduce the stigma for these various diagnoses that exist, especially for depression that affects so many people, 21 million adults in the United States alone.
And on different levels.
And on different levels. And I think that despite it being 2024, there are still a lot of misconceptions that exist about depression. Recent survey data showed that up to 60% of Americans don't believe that psychiatric intervention or medication is a good way to treat depression, and up to 30% feel that it's caused by having weak character, which we know isn't true. Yeah, depression is caused by a lot of different factors.
What should we know about depression and those who may be suffering from it?
Well, I think, most importantly, it's not a character flaw. It's not a sign of weakness. We know now that depression is a disease of the brain. So just like diabetes or asthma are diseases of various parts of our body, depression really is a chemical imbalance in the brain. And we know that it's caused by a mixed bag of genetics and then environmental factors. And that could be good and bad life events. It might be something like an illness, or it could be something that we would typically look at as a happy event, like having a baby or starting a new job. We also know that while some people will recover from depression without intervention, a lot of people need some type of help in order to fully recover. And that can be medication, it can be therapy, a combination of both, but most people will need some type of support.
How do you know if what you're looking at or dealing with is depression or just they're in a bad rut? They're, is it something that's just a temporary issue that will work itself out? How do you know when you need to start taking some steps toward looking for help?
I think we're really looking at the duration of symptoms. So if this is something that is a prolonged reaction to some type of stressful life event, or somebody's been in a rut for a really long time and it doesn't seem to be changing, that would be a good indicator that maybe we need some additional support. And also important just to recognize too that depression affects men, women, all races, ethnicities, and genders. But men, because they're a little less likely to talk about their emotions, are less likely to be diagnosed. So for the men out there, important to talk about those symptoms if they're experiencing them.
And I would imagine October is Depression Awareness Month because the season's changing, it's getting more darkness every day, and that's when I think a lot of people, especially in our area, start to feel it a little bit more isolating time.
And we're getting ready to jump into the high pressure holiday season.
High pressure holidays, it's dark when we wake up, it's getting dark when we leave work, so absolutely, we do see an uptick in depression around this time of year.
A great place to start if you're looking for some resources there is the number on your screen for Barber Behavioral Health. And we have a lot of resources throughout the Erie area for folks to just start making some phone calls. But the most important thing is to just kind of reach out and ask some questions.
And our care coordinator is happy to help and provide those resources.
Yeah, perfect. Cecilia, thanks.
Thank you.